A very good evening to all my colleagues who are present here, who are joining us for this live session today. I'm very excited that we are back with this series, and today we have two very eminent speakers, and today's topic is around trauma. The topic is trauma and healing. So we are going to understand a lot about trauma, how it's affected, and how to deal with trauma. So today's session is going to be moderated by my colleague Kritika Saxena. I would like to call her in. Hi, Kritika.
Hi, Anuna.
Okay, so let me give you a short introduction about Kritika. So Kritika Saxena is the lead of psychological services at Sukoon Health, and it's a sister concern for Fortis Healthcare. She is a licensed clinical psychologist recognized by Rehabilitation Council of India. She uses an eclectic approach to help her client in dealing with issues they are facing, wherein she incorporates various techniques of psychotherapy. So, Kritika, a warm welcome to you,
Thank
and the stage
you.
is all yours. All the
Thank
best.
you. Hi, good evening, everyone. We are here for our Bharat Panchal Dialogue, and today we are talking about trauma and healing. I would like to call upon our first speaker, Dr. Mary Rockwood Lane.
Hi.
Hi,
Hello. I'm so happy to be here.
we are glad to have you here.
Thank
So,
you.
Dr. Rockwood Lane is a PhD RN FAAN. She's an author, a speaker, an artist, a professor, a nurse. I think you had your doctorate in nursing, and you
Yes,
are
I
a
did.
characters coach. Wow, that's interesting. Maybe we'll want to know more about that. What's a characters
Okay.
coach?
Yes, I do a lot of work. I'm so happy to be here. I'm excited to share my work and my work with art and healing and trauma.
That's great. That's great. We would like to also have our second speaker, is Miss Shireen. Hi, Shireen.
Hello, how are you?
I'm all right. How about you?
I'm good, thank you. Thank you for having me today.
We're losing you a bit, but yeah, I think we have you back on.
Okay, sorry.
Shireen
Thank you for having me.
is Shireen is a licensed board certified art therapist, and she works out of Brooklyn, New York. And she's also the founder of Art Therapy Collective.
Yes.
Yeah, that's great. That's great. I open the floor to you, and maybe we can start with Dr. Rockwood, maybe some of your experiences in the field.
All right. Well, I'm very happy to be here, and I want to start by just asking everybody who is on the call to just take a deep breath, allowing yourself to settle into this wonderful time we're going to share together. And I have a singing bowl here that I got in Kathmandu, Nepal, when I was visiting there. I've actually been there before. And it's a beautiful, beautiful sound that helps us just relax, going deep into ourselves, allowing ourselves to move into this wonderful time that we're going to share together. And I want to invite you to really be able to give this time to yourself in a way that we open ourselves to almost in this moment how we can deal with wherever we are and moving from ordinary awareness to extraordinary awareness, allowing ourselves to be open our hearts, open our minds, so we can create a sacred space to share together. I'd like to introduce myself. I am Mary Rockwood Lane. I'm an adjunct professor at the University of Florida. I teach at the College of Nursing. I teach a course called Creativity and Spirituality in Healing. And then I also have a course that I've written several books on healing with the arts, and I've studied what the experience of using art is when people share their lived experience of such, of when they do that. So I'll share with you some of my personal stories of how I discovered art in my life after a very, very traumatic event, and how I worked with bringing artists into a hospital setting where we could engage with the artists from the community as part of your healing journey when you were hospitalized, and how it transformed not only actually transformed the culture of the hospital. So I'm very excited to share with you my stories, and I'm here and I welcome all of you.
We'd love to hear all of your stories, Dr. Rockwood. Shireen, would you like to share something with us?
Yes. Hello, my name is Shireen Baraor. I am a licensed creative arts therapist based in Brooklyn, New York. I am the founder of Art Therapy Collective, which is a practice that provides art therapy to individuals, groups, workshops within the community. It is officially launching this month, so it is still very new, but hoping to reach a wide audience, and have already been really successful in bringing art therapy to the community. I'm also social action chairperson on the New York Art Therapy Association board, which has been a really beautiful opportunity this last year to provide not only a lot of support to our art therapy members based in New York State, all throughout the city and upstate, but also to bring an awareness to the community of the inherent healing power of art and creativity and self-expression. Most recently, I partnered with a grassroots group known as the All Street Journal, and they put on a lot of protest art events where we invite the community to come to public spaces and parks and outdoors, of course, and we create art together, and we share ideas, and we offer support. A lot of information on voting. We had a very big election just passed, so we wanted to make sure that our community had the necessary information to access voting in their communities. So that was a really beautiful initiative. And more recently, we are also helping the community through another initiative with New York Cares, a coat drive. Since 1988, they've been offering New Yorkers in need with brand new winter coats. It gets very cold here, so we have a goal to raise $2,000 to donate 100 coats to New Yorkers in need.
That's
very
right.
cool.
Thank you. Yeah, got to do what you can.
Yeah. So if any one of you would first like to share, how did you, like Dr. Rockwood was saying that, she would also like to share with us what got her into art therapy.
Yeah.
So
I would love to share that because it was a very traumatic time in my life. I had, I was young. I had 2 small children. I was going through a very, very traumatic separation with my husband at the time. And I became severely depressed and very traumatized by the experience. And I was in a situation where I was going to therapy and I was trying to find help, and I was doing all kinds of things with workshops and therapy and everything. And I just was drowning in minute by minute by minute in my experience of despair and rage and trauma. And a friend of mine who was an artist invited me to her studio. And I was so angry and so hurt. I had this experience of like unacceptable emotion, basically. I was so upset and angry. What she did is she gave me a canvas in front of me, and I started painting. I started painting my feelings. I started painting my anger. I started painting my despair. And I ended up painting over a 6-month period a series of women that started out really broken, really raw, really grotesque, really ugly. And I proceeded to start painting these images of women that actually transformed into self-portraits. And as they moved into self-portraits, I began to recognize that I was able to freely express myself, and I couldn't do it in any way in my life. I just wasn't able to have that like your body just needs to release itself in a way. So it was like the painting sort of captured this experience. And over time, I ended up painting a portrait where I was like strong and I was healed and I was calm, and it was like this portrait of myself, and it was like a total transformation occurred in the process of painting that just happened. And I realized that I became an artist, and I didn't ever paint before. I had never painted. They were 36 by 36 giant paintings. And I was so amazed that not only was I healing, but I actually became an artist. I discovered my expression as an artist. So I was so excited. I could not believe this was happening. I had this unbelievable transformation that was reflected in my art. Like I could see from the first painting to the last painting, there was this incredible transformation that happened. And I went from a broken down, bleeding, despair, these gross pictures, to this painting where I was strong and was whole. And I was like, oh my gosh, I'm better. I'm better, and every time I left the studio, I would come back to the studio and I would look at the painting, and the painting captured something in my body. And it was like I didn't feel it anymore inside of myself. I had this release, this catharsis that was so dramatic that there was like a letting go. And it was so profound that I discovered that I loved to paint, and I started painting. But being a nurse and being in healthcare, I just made this discovery, and I thought, art, everyone is an artist, because I never thought I could paint. I think I need to bring the arts into the hospital. And how can we invite patients and families and staff to use art? And I was very idealistic at the time. I was like, oh, we just have to dance in the hallways and bring in musicians and bring in painters and bring in poets and, recreate this environment. So I created something called, I met with a physician who was a doctor. He was the medical director of the bone marrow transplant unit. And I met with him and I told him about my experience. And I said, I really would love to do a call to artists in our community. And this was in the beginning of the 90s. I would love to create a calling and ask artists how we can bring this work into the hospital. And the bone marrow transplant unit was a very, very challenging unit, because 50% of the people who went through a bone marrow transplant actually died. So there was a lot of grieving, a lot of sadness, a lot of pain, and a lot of suffering at that unit. So it was like, how can we make a difference in this environment where there's so much pain and suffering? It began there. And we started exploring the possibilities of working with families and working with the staff. We eventually worked with the staff, the physicians and the nurses, so they would give us feedback with what would work in that kind of situation where there was so much pain and trauma, and what be of the greatest use in that environment, and how to learn to bring the arts into rooms where patients were so sick. And so that was the beginning of that. And I created a residence program at Shands, brought in artists, and we weren't doing therapy. All it was bringing a musician in the room with someone who was dying or someone who was suffering, and have the musician ask them, what can I do? Do you have a favorite song I can sing to you? And the patient would say, this is my favorite song. And then the musician would play the music for the patient at that time. So it was just, really, it was like in the very beginning, it was like, what can we do to make art soothing in your pain and suffering? And it was very dramatic, and it was very, very powerful. And it became a program, and now it's been replicated in programs. They're called arts and medicine programs, and people are bringing artists and art therapists and a music therapist. There's this huge shifting in value in our culture of how powerful art is in healthcare, in these situations, and how we can actually make a difference by integrating the arts and the artistry. You know, one of the things we discovered is everyone's an artist. Even if you're a physician or a nurse or a clinical psychologist, you're an artist. And how do you bring the arts into whatever it is you're doing as part of your practice and as part of creating a healing environment?
Wow, that's a beautiful start. That's a beautiful beginning that you shared with us.
Thank you.
Shireen, would you like to also share your story, how you got into art?
Yes, of course. So similar to Dr. Rockwood's experience, I found the healing and the inherent power of creativity and self-expression from a very young age, but I don't think it took me some time to truly materialize and understand it. I'm the daughter of two immigrants. Both of my parents were born in Iran. They later moved to Israel and then came to America. And in that experience that they each, similar experience, but a shared experience, they carried a lot of trauma within them. And that intergenerational trauma was born into me here I was born in New Jersey. And I also never really had the opportunity to explore that. Mental health is not a very open subject, especially in Iranian culture. Persians are not very big on self-expression and emotions. It's very much a culture that identifies with getting through it and doing what you can to survive. Survival is the most important thing, but it's also really important to address these issues within us. And I found that anytime I tried to express myself verbally, I wasn't understood. I wasn't able to be supported. It was very much an atmosphere of not being able to discuss your feelings. So at a very young age, I became creative, and I don't think I even recognized why I gravitated to it. And then I also recognized I would be praised for being creative, and I was like, it took a while. And now as an adult, of course, I can go back and organize these thoughts. But as a kid, it's like, oh, so strange that I don't have space to discuss my emotions or feelings, but when I do something creative, I get praised for it. And I think that created a safe space for me to explore what I was feeling internally. So I always sort of was connected to the arts through my upbringing. And then once I was in school, in college, I wanted to learn and understand more about psychology. I was always interested in psychology, but I went to a very liberal arts school in St. Petersburg, Florida, actually, Eckerd College. I majored in human development with an emphasis in international relations and global affairs and a minor in visual arts. They're very flexible and open in creating your own education, which was a very empowering opportunity for me. I never really did well in school because I just didn't have a lot of support, and I was never an academic person. But I always knew I wanted to be in the helping field. And I was actually speaking with Dr. Rockwood and Kritika earlier, saying that I always wanted to be a psychologist, but when I became old enough to understand the path of psychology, I also knew that being academic is not one of my strengths. So I wanted to explore master's options. And in the States, there's a lot of 2-year programs to become a licensed mental health counselor, family marriage therapist, social work. But when I discovered art therapy, it really spoke to me because there was this inherent creativity and flexibility in the approaches. And I felt that in social work and a lot of other clinical fields, it was very much like, let's look at the symptoms and treat them. In art therapy, it's saying, let's look at this human being. Let's look at this human being within the system that they exist in. Let's look at their upbringing. Let's look at their framework and their understanding of the world, and let's start treating them more holistically and comprehensively. And to me, that was really powerful. And I've worked in hospitals. I've worked in different clinical settings. Now I'm in my own practice, but just seeing whether it was in after school programs or hospitals, in foster care systems, just how powerful it was to help provide this creative tool to people who don't have a voice or don't have space to have a voice or don't have support to find their own voice or to use their voice. And that was something that has always sort of stuck with me and has evolved. And something else that again, I'm always learning. This is never a field where you can say like, oh no, I know this. It's, it's Excelsior, ever upwards. You're always learning. And something that I'm discovering even now that's been so beautiful is the power of change and creativity. The fact that I'm an art therapist in my family is pretty, unheard of. And just by virtue of making that change, I already see a lot of change in my community, in the Persian community and within my family, just this sort of ability to self-reflect and to acknowledge and speak to issues that didn't really have space or a platform to address in the past. And that was something else that was really powerful in my experience, learning that I not only have the power to change my experience and to make sense of my experience, but also my bravery or my ability to like do the unknown or step into the unknown, others to say, oh, I can also do that. And for them to blaze their own path, which has been something that I'm very grateful for.
Yeah. Wow. That's an amazing story. I think in both of your beginnings, I see that it's so personalized that it was the events in your own life, they set you all on this path. So you're very close to it, and that's how you found it, and I think that just brings a lot of attachment, and also the feeling of being grounded to your work, because
Right.
you know how great it is and how it can transform a lot of things, because it did for you.
Mm-hmm.
Absolutely.
That's great. That's
Locks.
sorry.
It almost feels as though it unlocks a lot. It accesses parts of yourself, parts of your experience, parts of the world that you might not have been able to understand previously. And saying before, art is the universal language. So being creative and allowing that form of self-expression to come out non-verbally is such a powerful experience internally and externally as well.
Yeah. Wow. That's great. That's great. So, for our audience, I mean, I want to ask this one question. So, generally, people are of the view that, oh, before that, we have a comment. Kamna Chibur asks, can you share what trauma is and how it manifests and can be identified within the clinical setting?
Sure. So trauma is described as.
You want me to answer?
Oh, sorry. Go ahead.
Go ahead, Dr. Rockwood.
You go ahead.
Sorry, my screen is a little bit blurry, so everything's a little bit jumbled, but feel free to go ahead and I can add on.
All right. Trauma, there's a tremendous amount of work on trauma nowadays. And since I'm not a clinical psychologist, I don't know exactly how it's defined, but Shireen can speak to that. But one of the things I have done recently in really working with Thomas Hubel on collective trauma and how we have trauma that has been stored in our bodies through our ancestors. There's a lot of work in not only do we have significant traumatic events that we have in our life, we're body, but we also have trauma from past generations, which I also think is very powerful. One of the things, the course with Peter Levine called Somatic Expression, and he defines trauma as a event that happens like post-traumatic syndrome, where people go through experiences and there's an event that they traumatize they internalize, they integrate it into their physical bodies, and then it becomes a trigger. You know, they have a trigger that other things will initiate their trauma. One of the things I want to share with you about what I've learned with integrating the arts into working with
We
Oh no, I'm frozen.
Yeah, I was frozen. Why don't you, Shireen, you tell what your definition of trauma is?
Sure. Yeah, because I think when we discuss the manifestations, we can go into like a million different stories.
Yes, exactly.
But essentially, trauma is described or defined as a deeply distressing or disturbing event that interrupts your ability to regulate on a daily basis. So something happens, and also before I kind of describe it more, the interesting thing about trauma is that, bless you, what's traumatic to you might not be traumatic to me. What's traumatic to me might not be traumatic to you. So we might go through the exact same event and internalize it differently. And that brings up the topic of resilience and support systems. So it is a very difficult term to define, but for the sake of providing clarity, let's describe trauma as a deeply distressing event that creates dysregulation or an inability to perform everyday tasks as you normally have in the past. Some examples of trauma can be divorce, natural disasters, moving, and the intergenerational trauma that we were speaking to, just moving as immigrants from one country to the next. That can be a very traumatizing experience. Abuse, there's a lot of different forms of trauma. And like I said, it depends on how we internalize it and what our coping skills are and what our support systems look like that determine how the trauma affects us. There's three different types of trauma. The first is acute. So that is like one single stressful event. So like a natural disaster, that is an acute trauma. There is complex trauma, which is like a lot of traumas throughout the lifetime. So let's say you grew up in a system of neglect or abuse and poverty, like all of these different factors contribute to complex trauma, which makes it a little bit more difficult to treat just because it creates a lot of disorganization and chaos, and there's inherently less support in complex trauma than in acute trauma. Okay. Not always necessarily, but typically somebody who's experienced complex trauma has a more difficult time accessing coping skills than somebody who might have just experienced acute trauma.
Right.
And then I believe the third is chronic trauma, which is like repetitive types of trauma. So like similar to complex trauma, if you grew up in an abusive home, that is chronic trauma because every day you're mentally trained to be prepared to face abuse. And that also takes a toll on our psyche because we are conditioned to expect less than what we deserve from the world. And that takes a toll on our psyche. So the three forms of trauma are all kind of related. It is possible to experience all three forms of trauma in our lifetime. But the severity of the event that is a trauma is very indicative of how we approach the client in treatment. I hope that is clarifies a little bit.
That's very helpful. A part of the same question is, how do you feel that, these various types of traumas, how do they manifest themselves? Like, are there any physical symptoms? Are there any emotional symptoms, mental symptoms that, we are able to see in an individual?
Oh yes, and that's where it's endless. What can be manifested? It can be manifested as stress, irritability, depression, but essentially the places in the brain that trauma affects are really it's the amygdala, the prefrontal cortex, and the hippocampus. And these three parts of our brain are responsible for executive functioning, which is decision making and basically just being able to like organize yourself and to regulate. So you might be disrupted and dysregulated. You might feel stressed all the time. You might not be able to wake up in time for class or school or whatever, your normal life looks like. So it can be very disruptive. You might, it also, the hippocampus and the amygdala are in charge of your emotional response. So you might have a heightened emotional response. Somebody might not hold the door open for you, and instead of, being like, oh, whatever, you might, act out. You might have really bad displacement, which is when difficult emotions sort of carry out in a different place, a safe place, because you don't have the ability to process and assess where that's coming from. So a lot, again, I hope this clarifies, but it's such a thing.
That helps us a lot. That's helped us a lot. Right.
Yeah.
Dr. Rockwood, would you like to add something to that?
I think she did a fantastic overview of the definition of trauma. I think trauma is exhibited symptoms as far as anxiety.
I think we lost
emotional expression can be very indicative of someone who's been traumatized. I think also trauma has an effect on, a low grade sense of not being able to function adequately in a world and being triggered by events that cause over-exaggerated reactions. For example, in the world that we're living in, where there's a constant bombardment of stress, I think people who have had complex or chronic trauma don't have the ability to have the resilience because they're spending so much time using their in the world that's very stressful for them. And I think the stress response, the fight or flight, where people get like angry and they start to fight and it becomes misplaced, where there is not, and they become triggered to fight or they become triggered to flee. And that creates all kinds of dysfunctional behavior.
Yeah.
Mm-hmm. Yeah, and to add to that, I'm sorry, I don't know.
Oh, am I going in and out?
It got frozen.
Yeah.
Oh, okay. All right, but I think you did an excellent response of what it is and the stressor, the fight or flight response and how people react to that, and also how it totally changes our personality and ability to function in the world.
Absolutely. And I'm glad that you brought up the trauma response, like traditionally the fight or flight, and something that's so interesting. Again, this is a field that you always have to continue learning because it's ever changing and ever evolving. Something that I think is also very interesting is that there's also new responses that we're discovering. Fawn, fight, flight, fawn. So fawn is when we just sort of, fight, flight, freeze, and fawn. That's it. So the fight response is, when you kind of show up and you're very engaged and you're present and you're ready to go. Very stressful, very, very intense. Flight is when you flee, you run away, you escape. Freeze, you're frozen. You're present, but your body is not responding to your thoughts and your feelings. You're just frozen in the moment. Fawn is a similar effect, but fawn has the intent of protection, self-preservation. This is typical in instances of abuse or danger or bodily violation. Sometimes we fear for our safety, and the only thing that we can do is fawn and just allow ourselves to disconnect and disengage, disassociate from the moment itself. And like you touched upon, Dr. Rockwood, this particular trauma response brings up a lot of negative impact on the client in the future because they look at themselves and they say, why didn't I fight? Or like, why did I allow this to happen? A lot of victim blaming happens from that response. But it's so important to understand that these trauma responses are not something that you can control. And you might say like, oh, if I was in that situation, I would run or I would fight or I would scream for help. But when we are in those situations, we don't know how our bodies are going to react. So it's important to remember that because sometimes we feel betrayed by our own experience, by our own bodies, and that can be very hard for the client to process.
Right. Great. We have another question. In the recent COVID pandemic, have you seen an increase in traumatic circumstances that people may have gone through? And how would those symptoms manifest? This is so strictly for the COVID pandemic.
Would you like to go first, Dr. Rockwood?
Well, I thought it would be really interesting for you to speak to how you are working with. I think what you're saying is there's a lot of people who are at home who are, dealing with themselves and can't run away from themselves. Mm-hmm. So I could speak to that, and then I would like to talk about this intervention that I created during the pandemic that has been very useful for people. So I wanted you to address what's going on when people are, because you had spoken to it before, when they're in isolation, they can't get away from themselves, they can't do what they usually do, they can't go out and, distract themselves from the things that are coming up, or they've, tried not to face. And then during the pandemic, now people are at home in isolation, they don't have the normal ways of living, and the stuff's coming up, it's happening, things are emerging. So I wanted you to speak to that, and then I can talk to you about this online course I created that's really been tremendously.
Sounds good. Okay. Yeah. So coronavirus has been a collective trauma for the world, which is kind of wild because it's something that we're all experiencing together. But it is something that we're all experiencing very differently. Again, similar to what I was speaking to in terms of what dictates what is traumatic to who. Where are you? What are your support systems? What are you able to access? What are your resources? So what I was sharing before we began the panel is what I found in my practice with some of my patients. It was very interesting in the beginning of the pandemic when everything was shut down. A lot of people were forced to face the problems in their lives because they didn't have access to the same distractions and deflections that they normally had. We couldn't go out with our friends. We couldn't exercise, or we couldn't, go out and have a drink, or whatever, your method of handling your issues were. People didn't have access to that. So they were really confronted with what was going on in their lives. And for me, it was great because I was like, nice, we can do the work and they're ready. And it was really helpful. But it was also very interesting to kind of see how that came from trauma. And I think that's also something to keep in mind. Trauma is something that's a really powerful, difficult experience, but it doesn't need to be something that defeats you. It doesn't need to be something that, it's not the end. It is an opportunity for growth. It's a very difficult opportunity for growth, but it is something that can help us to build resilience. And building resilience is, again, an ever upwards process. Life will always present different challenges, no matter what. To be human is to experience trauma. So the more resilience we can build and the more opportunities we have to build on that resilience only really helps us to continue moving through life in a healthier way. I think, was there a specific question in terms of what sort of treatment was implemented for coronavirus?
So it isn't there, but yeah, sure, we could also discuss that.
Sure.
How is the treatment different from sorry, no, not this one. It doesn't say treatment, but really we would like to know more about that. Have you been able to get in touch with people who have been experiencing a certain kind of trauma in this pandemic, and how has that been?
Well, I would like to, I have developed a course on Coursera that was called Healing with the Arts. And it's a 6-week program. It's totally free and it's online. And I wrote a book called Healing with the Arts, and then I developed a course, using the book and doing a video-based course. And this particular course, it had 20,000 students, learners enrolled in the course before the pandemic. And now it has over 60,000 learners enrolled. And it has been a tremendous resource for people who are at home, who basically I'm inviting them to explore their creativity. It's a course in which a person can get involved and they can do visual arts and they can do music, they can do dance, they can do poetry, they can sort of explore the different modalities that resonate with them, and then begin to engage, and there's more resources to continue to engage in exploring their creative expression. Because one of the things that's happened during the pandemic is obviously we can't do what we usually have been able to do before, and we're home in isolation. So since I feel like we have so many resources within ourselves, that living our ordinary busy lives, we don't really slow down and pause to consider what are the resources we have right within ourselves. So it's given a lot of people an opportunity to sort of slow down and attend to, like you were saying, things are coming up, pains are coming up, anxiety is coming up. How do we deal with that? Well, one of the things that I have found, since I'm very involved in integrating the arts as a modality, really inviting people to explore what kind of creative activities express that you can use for your own personal actualization and expression. So that course is free, and it has resources for other courses. It's called Healing with the Arts, and it's free and it's online, and it's on a major platform called Coursera, which is a university platform where courses are available all over the world. And I think finding you at home, what can you find at home, the resources at home? Because, like, for example, during this time, I would ask someone you're working with, what is something that you've never had time for in your life before this pandemic? Were you ever a dancer? Did you ever make music? This might be the time in your life to return to something that you're passionate about. That living our ordinary busy life has kept you going, and we've neglected parts of ourselves that make us whole. Yeah. And our wholeness, this is really an opportunity to return to ourselves. This pandemic is a time to return to ourselves and return to the people in our life that are most essential. Who are they? And how do we stay connected to them? And it's really an opportunity to make an assessment of what it is most important to you. What is it that you yearn for? What is it you're most passionate about? Because we're dealing with trauma, we're dealing with stress. Mm-hmm. So it's an unbelievable time to really reflect on how we can deal with our past trauma in new and creative ways.
Yeah, absolutely. I would love to echo off of that, because I think it is also so important. I know I spoke to resilience earlier and how resilience is dependent on what sort of resources we have at our disposal, what our coping mechanisms and skills are. But it's also so important to clarify that there is a wealth of knowledge within us all inherently. It is a very basic human drive to want to thrive and survive. Like, that is in all of our cores. So if we allow ourselves to notice, to stop, and to actually just notice what it is that we're experiencing, it provides us with the opportunity and the space to identify what it is in our life that is creating these obstacles. Obviously, trauma is a catalyst in this awareness, but we still have to be mindful of, well, why am I responding in this way? Why is my framework built in this way? And a lot of that is developed before the trauma occurs. So taking the opportunity to step back and question your framework and understanding, and then building upon the skills that you already possess, leaning into your strengths and developing your areas of needed improvement is a really great way to build that resilience and to work through that trauma.
Yeah.
Trauma can feel hopeless. So I wanted to just, it makes you feel powerless. So I just really wanted to say that, because it's important to remember when you go through these traumatic events, there is an other side, there is a way through.
And what you're saying is true. Trauma has the capacity to incapacitate you and feel that, oh, there's just no moving forward from here. So I think it's really important for us to remind ourselves that, okay, there's another side to it, or this moving on, we can move on.
Yeah.
Absolutely.
Great.
As a young woman, I had intense acute trauma. I had been, I broke my back, I broke my arm. Through a very short period of my life, I had a tremendous amount of trauma. And what I did at that point in my life is I was in college, so I distracted myself by getting into school, going on with my life, and putting the trauma behind me and not thinking about it and actually erasing it from my memory. When, for example, I had the crisis, another crisis in my life when my husband left me, without my consciousness, I became so traumatized, exaggerated. I became exaggeratedly traumatized by the divorce from this old suppressed trauma that I literally had forgotten about. But when I was at this other time where I had another acute traumatic experience, I basically had a breakdown. I could not control the amount of pain, anxiety, despair, and fear that was coming out of me. And I was at that time in my life, I was unconscious of the relationship between the trauma at 19 and the trauma in my 30s. They seem totally separate. They seem totally different, except that when I was at this age, it was so exaggerated. Like, how can you be so distressed? How can you become so suicidal and so dysfunctional based on what's happening? You've over exaggerated it.
Mm-hmm.
That's why I think when you make art, speaking is like a consciousness of knowing what you need to talk about. But when I started painting, it's like I didn't know what I was dealing with except the expression somatically that I was in terrible, terrible, terrible pain. I couldn't make sense of my life. It made no sense why I was so desperate, why I was so traumatized, why I was so hurt. I couldn't even find words to describe it or identify it as such. And that's why through the painting process or through dancing or through music, you allow the unconsciousness, the unconscious part of yourself that's somatically traumatized, begin to move again. You begin to move this old pain that you can't even put words to the pain because you've forgotten it and you don't want to know it and you don't want to remember it. But it creeps into your life anyway. So when I started painting, it's almost like you unconsciously, through the creative process, can heal trauma without even speaking to it. And I've watched this in many circumstances because the somatic traumatic experience can be so overwhelming that we become disconnected in the experience of the trauma as we reignite it again. It's not like we understand it better 30 years later. At least I didn't. I didn't understand. I just couldn't figure out what was happening to me. It was through years of painting and years of dancing and years of slowly releasing the trauma in my somatic body that I became ready to understand my own experience. And that's why I think creativity is so important. And one of the things I discovered when I have a student, for example, or a client who's working with trauma that like, for example, I had a young man whose stepfather killed his mother. And he told me that he might do something around that. He wanted to do music, do playlists. I said, that sounds beautiful. And I said, just be gentle with yourself as you return to this experience in your life. Just, don't push yourself. Just be very gentle. Let yourself, approach this part of yourself very lovingly, very kind. You're in a sacred place. You're safe. Just hold it there as an intention, but don't push it too hard. Just let it emerge from within you. Well, we had an opportunity in class to do a theatrical piece. You know, the class was getting together and I was inviting students to do theatrical vignettes about whatever. I did a guided imagery and I said, just do a theatrical vignette, and each student got 15 minutes. And he did this theatrical event that he went back into the moment when he experienced the trauma. Mm. And he relived the experience, but he was in a different time, a different place, in a safe circle where he could act out this experience and integrate it in a different way. And I'm sure Shireen knows what I'm talking about, because I'm not a therapist, so I don't process, but I just sort of hold the space for it. So he reenacted this experience, and it was powerful. Mm-hmm. It was so powerful that everybody in the room, he didn't speak any words, but everybody felt the energy, and there was crying, and there was this energy of just like shock almost, because it was a shocking event. And he didn't say anything, but everybody felt it, his pain, his suffering. And when he was done, he gathered himself together, and I could sense he recreated the experience, and it shifted. It was released in a different way, where it shifted his reality and his ability to deal with it in a different way, because he was able to express something in a safe way. Now that's where Shireen would take over and process it, but I'm not a therapist. So I just hold the experience, contain the space, say appreciation, and let it be what it is. And my feeling, as I'm a nurse, I have tremendous faith. I do have resources for the students to go to process it, but I really have a tremendous faith that people can handle. They already handled it, and we can handle it in this moment with grace and love and contain it. And I have faith in the ability for there to be a healing, a reintegration, if you know what I mean. So you might talk to that, Shireen, how you see that I'm sure you see that in what you do all the time.
Yes, those are the best.
I'm not a therapist. I do it in seminars and workshops and classes where I create these containers, and whatever emerges spontaneously. And it can be very powerful, but at the same time, I have, I just create a safe space. And our ability to heal from trauma is sacred and so powerful and unbelievable when we just create space.
Right.
It's amazing.
We don't often do that. And I think you spoke to that earlier, how COVID actually provided the opportunity to stop and notice and to see these things. And I think also what you're speaking to, I was glancing at the comments, and I feel like a lot of people are wondering how to effectively treat trauma and how to use art therapy interventions in that. And it feels like what you're speaking to is the first step. Creating a safe space with your clients is the most important thing in treating trauma, because you are working with a person who doesn't trust their own experience, doesn't trust the world around them, is in a very heightened state of just complete violation and distrust and helplessness and powerlessness. It's a very difficult place for a human being to be. It feels like nothing I can do. And I think you very powerfully encapsulated that in your experience. And like I said, to be human is to be traumatized. We all have experienced trauma in different shapes and forms in our lifespan, and we will continue to face traumatic events, nature of our human experience. So when it comes to treatment, it's really important to create that safe space. And you can do that in a multitude of different ways. And you can apply art therapy interventions and directives there's so many different applications, which is what makes it such a great field. But something that can help, I saw somebody ask about interventions should entail, especially in early 20s and middle adulthood. That's a great question. And I think it also is very much dependent on how open the client is in engaging in the art process. A lot of people are like, oh, I'm bad at art, I don't want to. No.
Yeah.
That's when you can also emphasize that it's not about the product, it's the process. It's just about engaging with it, allowing yourself to be open enough to do something that you might not be comfortable with and to trust that it will be okay. And this is also a parallel process to what we're speaking to in the transformation of trauma. It's accessing a very difficult event that was out of our control and allowing ourselves to re-experience it in a safe space, in a healthy way, and to transform it into something that we can exist with, that we can live with, transforming the experience itself. So depending on what your client's openness is or skill set is, you can have an open studio. You can allow them to just free create and allow them to have that freedom of choice. That's a very powerful way to build that trust and to also provide options and empower people through having choice again. Something also that stuck out was, how is treatment different with children than from adults?
Yeah.
With children, I feel like everything is in metaphor. So you can, you can talk about everything without talking about anything through play, through puppetry. I've used like Lincoln Logs to build a town, and then we created dolls to talk about, what's going on in the town. And usually what's going on in the town is what's going on within themselves or what's going on in their home. And that provides them the opportunity to work through those experiences because they literally created a new setting to re-experience and reintegrate challenges in their life where they're in control. And that's a really also helpful opportunity. Like sometimes I'll see the child is the aggressor. The child is the one who's acting out on the violence, or the child is afraid and hiding. So you get a deeper sense of what their feelings are and what is happening within them. A child is not going to be able to say like, there's a lot going on in my home and I feel very angry and I'm acting out. Like no kid is going to be able to say that. So providing them the tools and the opportunity to engage in a way that communicates through art, through creativity, really helps us as treatment providers and therapists and nurses to gain a better understanding of what their experience is. And then from there, we can adjust our treatment.
Yeah. Dr. Rockwood, would you like to maybe comment about the same? How is the trauma in children different from that in adults in terms of its presentation and its treatment?
Shireen, you can speak to that because you're dealing with, nurse with therapy with it as a therapeutic process. So.
Oh, sure. Yeah. I would say one of the bigger challenges in working with children is similar to what I was speaking to before. The reason why I like art therapy is because you are looking at a person within a system, within their experience, within their framework. When you're working with a child, you don't always have access to the systems that they exist in. So their families, their home life, the parents might not be present in the process. So it's very difficult because you might make all of this progress and then the child returns to the system that is detrimental to their well-being. And this brings up a lot and it's very difficult, but something that's been very helpful for me is to really believe in the power of planting seeds and knowing that like providing this child with tools and alternative ways of making sense of the world, while they might not have this control to really access and utilize those new ways of functioning because they're still children and they don't have that sort of autonomy yet. When they become adults, I do hope that those skills are still alive in them and are very much accessible. So it is about building that resilience internally. Because we can be any type of system in any setting and we can still make our own decisions. It's very difficult, to go against the norm or to challenge what we know and what we believe, but it is possible. So to provide those tools is really the first step in ensuring that changes can be made.
Right. All right.
The thing I would like to share is, what I was going to share just to end on to echo that is that as I worked as a nurse practitioner, so I worked with a lot of people with chronic pain. So I was working with the body, the somatic expression in the body of pain. And a lot of the work that I did with people was getting people to tell the story of their bodies and tell the story of their pain. And I've done a lot of work doing journal writing with people. I ask them to do a journal, and we do a lot of work around really scanning the body and letting the body tell its story through journal writing, through narrative writing, reflective practice, then allowing them to begin to write poetry about their practice. There's a lot of ways in which we can ask people to move into the inner world where they describe through a story or images what it is they're feeling inside their actual bodies. Because many times I find one of the interventions that's so powerful in trauma is the image colors. I had a patient who had fibromyalgia. She was severely in tremendous amount of pain, had gone through all the medical diagnosis and nothing was helping her. I asked her to write a journal and start drawing her pain every day and communicating with images to her practitioner of what her experience of pain was. And she ended up drawing about 150 drawings of her pain, and then emerged an artistic narrative where she was having a journey of what she ended up doing. She says, the journey for me is a journey of self-love and radical acceptance. And it was so powerful to find this journey in her drawings. And she was able to communicate with her physicians, with her nurses, and with her providers what her actual experience was that words could not convey. So there's so many interventions by integrating the arts into your clinical practice with patients, that one of the things that's hard, since we're clinicians, we want an intervention that has a specific outcome.
Yeah.
To me, that's not what we're doing here. We're having an intervention that can have any outcome. It's the outcome of moving from where you are to a place that's totally different, where you've created a new awareness with your client. They've been able to deeply connect with themselves and connect with the inner witness. One of the things I discovered in my research with art and healing was there were themes that emerged when I interviewed people who had trauma and used art as a way to, quote, heal. And I didn't know what they meant by that. So it was very interesting. They started with their suffering. They started with their pain. They started with the darkness. They started with the physicality of the trauma or the pain or whatever it was. And then when they started making art, it was as if they shifted into a flow, a new consciousness of being where their creativity began to emerge. And as this shift in their energy and they started making art, whether it was dance, poetry, drawing, whatever it was happening, it shifted into this creative process that was their own. It wasn't defined, it wasn't prescribed. It was whatever they felt called to do in their creative process. And when they got into the creative process, they began to have a sense of being a witness. They sensed insights into their own experience and their own internal world. They began to, like with fibromyalgia, she began to have more compassion for herself, deeper awareness of herself, and realization that what she needed to do was heal herself was the experience of self-love. I wouldn't come up with that, and I couldn't have given that to her the way she was able to find it in her own creative journey. She found it herself. It was deeply in her body. And I think, when people, I believe, when someone begins to, this sounds wild, but when you follow your creative urging, your yearnings, your creative energy, when you follow this creative energy, it's like you tap into a force that's within you that is so powerful. And it takes you right where you need to go to heal. It takes you there. And if you're in the relationship with a caregiver, a psychologist, a counselor, you can hold the space for that to help them integrate that experience. And I really believe that we're all creative. It's like this is our inner resources. And using art is just something natural. It's as if we grow. It's like it's our life force. So I really can't underestimate, I think it's so important to activate that as a modality. Bringing in the arts as a modality is just so important in dealing with helping people reintegrate trauma in their lives and emerge in a way of where they're more fully realized and more fully expressed. It changes their life. I mean, when I started painting, my life was changed. I would never go back to the way I was. And I actually bursting open with creativity where, after I did that, I wrote 6 books and I made art. I became a poet. It was just like something inside of me, a wellspring just opened up. Not to say I don't deal with my trauma, my depression, my emotional issues, but I have so many more resources to ride through life, like have the best creative life I can have and live who I truly am and accept who I am and have the resilience and the resources I need to heal myself. So I think that's so important.
Thanks for sharing that with us. I have another question. Bhamini asks, Shireen, maybe you can go first for it. In PTSD, there are recurrent memories of the traumatic event in various forms, such as dreams or similar events. How does art therapy help deal with that?
Great question. So what's really great about art therapy is that there are so many applications. So in this specific case, having the recurrent memories of a traumatic memory in dreams or just flashbacks, physiological symptoms, within the art therapy session, you can create a vessel or a space to explore that experience. So I would say, can you draw a picture of the dream? Can you describe the dream? Can you create a scribble drawing that describes how you feel? Can you create a line that shows how it felt? And it can be as basic or as simple as creating an image depicting the dream or creating a scribble drawing that just lets out some aggression and helps us to understand how and where they are in their experience. I think a lot of, and I appreciate that you spoke to this, Dr. Rockwood, we do often want our interventions to be very concrete and to yield these results. It's so important to let go of these notions because it's not how humans work. If we were more machine-like, maybe, but being open to receiving whatever information comes out from these directives and interventions is the best way to provide treatment because you're not expecting a result. You're understanding what's happening in the moment and you're showing up with your client, for your client, and you're allowing them to be where they are, which is really what they need to promote that safe space to continue this exploration. So on top of any physiological symptoms that they might be having from flashbacks or stressful responses, you can also introduce not only visual art techniques and directives, but also guided imagery. You can help them practice breathing. I've created images to help draw out and create a breathing map for clients. So they would also use that to remind themselves how and when to breathe. Box breathing is a very popular way of staying grounded. Guided imagery, breathing, sitting with our feet flat on the ground and allowing ourselves to just stay grounded and breathe through a situation really does help to yield a lot of positive results in addressing those physiological symptoms that really make us feel so wound up that we can't even access any verbal communication because we're experiencing so much trauma in the body. So creating that safe space, using art therapy directives, like literal drawing directives to help explore what's happening, or if it's beyond the capacity, if the person is beyond the ability to really sit and do that, you can always go back to focusing on breath work, using grounding techniques, and making sure that you are consistently cementing and solidifying that safe space and letting them know that, it's okay, you're here. One of my favorite art therapy directives actually is creating a mantra. And this is a helpful tool in reminding yourself to come back to the present place. So usually the word, I encourage people to come up with either one words or a short phrase. Sometimes it's breathe, sometimes it's here now, sometimes it's I'm okay. And then I'll have the patient use a white Sharpie, or not a white Sharpie, a white oil pastel, and we'll write the word on a piece of paper. So it's white on white, so it's not very visible. I wish I had images I could show you. But essentially, you have to breathe or focus or I'm okay or here now written down, and you can't quite see it. Then we'll take watercolor and we'll go over the oil pastel, and all of a sudden you can see the word a lot more clearly. And this act sort of helps us to recognize that we have this power to access calming forces within us, and we have this inherent ability to heal. We might not always be able to see it, but we do have the power to access it and to elicit it. And a lot of art therapy directives have that parallel process. So as they're doing this, they're processing it and integrating it internally, and then you can discuss it with them, and you can say, what was it like for you to have that experience, to see this show up, or to have this, to write this out, to choose this word, to write it out, not really see it, and then to see it kind of emerge. And then you're also with this beautiful image that they can keep in a place that they see every day. And that really helps them to stay grounded and to remember what their mantra is or what their coping skills are.
I think that's a beautiful symbolism.
I'll try to send some, if possible, I can send images of some of the artwork that I've done so that people can get a sense, but it's very easy. You need white oil pastel and watercolor and a piece of watercolor paper.
Yeah. Wow, that's beautiful. Dr. Rockwood, would you like to add to that? Anything about trauma in PTSD?
I think what I'd like to add is I would like to encourage all of you, everyone who's listening, to begin their own personal journey of reclaiming their artist within themselves. Because one of the things I have found when I integrated the arts into, the big healthcare system, the way we begin to share our work and share this work is really by our own journey and reclaiming the artist within yourself, so you have your own personal experience of accessing your creativity and the feeling of your creativity. Because as much as we speak of models and theories and research and academics, what's really, really transformative in our life that I have found is what we experience for ourselves and how we experience, and we know it to be true in our own bodies, and we know to be true. So one of the things I would encourage all of you to do is reclaim the artist within you. The untapped creative portal that you have within yourself is the best way to start, to understand what's possible for your patients. Because when you know something, there's many ways of knowing. We can know a cognitive way, we can have research, we can have science, we can have all these different models in which we learn about things. But I think the most powerful way of knowing is through personal and aesthetic experience. So when you engage in your own creativity and you pick up the musical instrument that you haven't played in years, or you start dancing because that was something that you loved, or you really value it as a healing modality, I think that is what's really critical in this journey of being able to give the most you can to the people you work with. And I have a resource that you can go to, and it's Healing with the Arts. And if you just write gift at Healing with the Arts, you'll have access to the information on the course. And you could do that, gift at Healing with the Arts, or you can Google it. But I think any way you do it, whatever approach you do. You know, I love this idea of doing an affirmation to start. You know, do something fun, do something simple, you know, do something that's integrated in your life, even just with your intention. You know, we can listen to music, we can do all kinds of things, but when we create an intention of using these different modalities as a way of healing ourselves and others, create a pray, just simple as creating a playlist that when you're having, when you need to relax, when you need to calm down, when you need to check out and you need to settle into your body, you have something, a resource that you've created for yourself. And when you create that experience for yourself, then you have the experience to translate that to your clients from a place of knowing and a place of embodiment. As the things I realize in the work that we do is we can talk, you know, we can talk about all kinds of things, but how do we really live it? You know, and I love Shireen. She's so beautiful in that she has so much experience and so much understandings of the psychological things, but the way that what I can tell you is make art so important and a way of healing in your own life. That would be my message to you, is reclaim the artist within yourself.
For sure. And I think what you're speaking to, somebody just asked a really interesting question, and it's so true. Isn't it tough?
I was going to come to that.
Yes, it is.
It is.
People, like we said, when you're in that place, we don't believe anything will help us. And art and creativity can also bring up a lot of insecurity. You know, we're taught that, like, in order to be an artist, you have to be good at making art. That's not true.
Right.
Everyone is an artist, and something that does really help to engage clients in that process is to show them by modeling. Like, you can access that creativity, that self-expression, and when you show up and you hold space for yourself in that way, it does provide a beacon of hope and a model for our clients to say, hey, like, maybe I could try it. Maybe this might help. And again, that's a process. You have to continue building that safe space and building rapport and trust. It comes with unconditional positive regard towards your clients and patience. So it's really important to make sure that you're also dealing with your frustrations in that process and your countertransference, because otherwise we're, you know, creating an unsafe space. And something I do want to also follow up with what Dr. Rockwood said is art therapy is not just pen and paper or painting. It's not just 2D art or even 3D art. It's any form of creative arts. So singing, dancing, moving, being silly, like telling jokes, listening to music, making music, anything that really helps to unlock parts of yourself or to access parts of yourself that you might not have been able to in the past. And that's also, like I said, an ever upwards process, ever evolving. I have gone through different phases of my creative self, from focusing on watercolors and outlining it in ink to gain a sense of freedom and then build boundaries, to creating candles, to promote self-care, to dancing like a weirdo. I'm alone in my room, and all of these it's silly, but part of that is allowing yourself to be silly, allowing yourself to step outside of like what you're supposed to do or how you're supposed to be, because again, that framework is a ceiling that we put on ourselves. I'm not supposed to do this. Oh, I have to be this way. No, you don't. And a lot of questioning that framework comes with allowing yourself to do the things that you might not have thought you could do or should do.
Yeah.
So true. It's so true. And one of the things that's really powerful is, as a clinician, I teach this course, Creativity and Spirituality and Health, and I teach nurses and doctors and counselors and journalists and recreational therapists. And what I do is I engage them to get to a project that engages them in their own creativity. And when they do that, they have this experience that they have embodied. They've embodied it. They know what it feels like. They have a sense, because you can teach people about the information and the research, but when you feel it in your body, that's a whole different way of teaching and learning. So it's transformative. And then we explore, how can you integrate the arts into your practice as a nurse or a doctor or a counselor or a therapist? Like when your client walks in the room, maybe music's playing, you create a healing environment. You become the environment. You know, all of a sudden, the shift of value when the arts, when you understand the power of the aesthetic effect that the arts have on the human being. You know, how do we activate our humanness? How do we share our humanness in a powerfully therapeutic way? You know, using music and using the atmosphere and art and creating a healing environment are so important. And it's like, how do we return to making the arts that's so important in our cultures and make them of the healing experience? It's part of the human experience. Therefore, it's essential. You know, that's all I can say. When you walk out and you see art, it means something to being human. So it must be important to be part of the healing journey. It has to be. It is critical.
Yeah. Rightly said so. Right, we've almost come to our closing time. So, beginning with you, Shireen, how would you like to, summarize all of that?
Well, thank you so much for the opportunity. It's been lovely. In summation, I would say start unlocking and accessing your own creativity and self-expression, because everything we do oozes of who we are. I went to a very experiential program, so I was very embedded with the belief that in order to provide commensurate care to our clients, we really need to understand what it's like to be in their shoes. So like Dr. Rockwood suggested, if you allow yourself to try these things and you reap the benefit of it, you become a model for your clients. And also, I mean, I know we're here in a therapist, capacity, or is like in the helping profession, but as a human, like, do it for yourself. We are all going through a lot in our lives in this world.
Yeah.
And it's important to show up for ourselves, because when you don't, you're not going to be able to help anyone else. So definitely access these pieces of you. If you want any support or more advice on directives, I shared my information. My private practice is Art Therapy Collective. You can find me on Instagram, ATCBKLYN, because I'm based in Brooklyn. And I'm happy to answer any questions that we might not have access, or if you have any questions about specific directives or ideas, I'm happy to share that information.
Thank you, Shireen. Dr. Rockwood, your closing summary.
Well, first, I'd like to have a deep appreciation for you and your committee. Hosting these Facebook events are just really wonderful and a great resource for all your listeners. And I also want to thank everyone who is listening to this live Facebook. I've never done one before, so this is exciting for me. And I also want to thank Sharif. I feel like you've been a fabulous balance between the two of us, coming from a deeper psychological perspective than me being a nurse and doing the whole thing. So I think we've been a great balance to present together. I really want to say thank you so much. And also I want to close in that one of the things I have found since I'm in nursing and my work has been integrating the arts into healing, one of the things we talk about in health is healing mind, body, and spirit. And one of the things that I discovered when we integrated the arts into the hospital and we invited people to make art, one of the things I discovered is that it was also not only a way where they're able to express positive and negative feelings and express themselves, but they also expressed their faith, which was a spiritual connection with themselves and their inner world of the spirit and what was happening to them in their lives. And the creative process allowed them to bring that connection to their essence into their healing. And I thought, when I did my research and I realized how many people spoke about the spiritual connection they had with themselves, and how they connected with their faith and what they believed through their expression of their art, I thought that was so beautiful, because, in nursing and in the med model, we treat the body, we treat the mind, we treat the psychological perspective. We say we're treating spirit, but how do we really do that? And I discovered that when you invite someone to make art, it's as if they reconnect to that part of themselves. It's so important to their journey of healing that they connect to their spiritual life. So I just want to say thank you so much for inviting me to be on this.
We are absolutely glad to have both of you here with us. Thank you so much for this wonderful dialogue. It was so insightful, and I'm sure our audience would have loved it.
Thank
Thank you. Thank you. You have a good day.
Thank you so much.
Bye-bye.
Bye.
Bye-bye.